Name's Kathleen Harris, I'm 60. General health, I had a heart attack, I've had a blood clot and various bits and pieces coming off of that. But with this, it started when I had a fall. The pain got worse and worse in the right leg and cellulitis developed. I had it before, so I knew what it was. It just kept on spreading, getting darker and blacker and smellier, but we just carried on with it. And then I was taking warfarin at the time, which was the whole reason that wouldn't heal, because of the warfarin. The other leg was fine. By that time, that's clear as a bell. This one just would not do anything at all. It was getting worse. So by the time I was stuck in bed, I couldn't stand up or anything.
My name's Helen Sanderson. I work at Southend Hospital in Essex, and I am now the lead clinical nurse specialist for wound management services in the hospital. A good example of our service development and change of practice was how we treat trauma to the lower leg, particularly pre-tibial injuries. We make an assessment. A lot of the time they need debriding, so they're off to theatre, have a debridement. That actually usually leaves rather a large wound, because actually there's a lot of deep tissue injury here. We decided that actually, I wonder if we could treat this the same way as we treat a leg ulcer, trauma to the lower leg, and can we use K2 compression bandage therapy?
The K2 came along after the debridement that was done on April the 11th. When I first saw the leg, they said they were going to cut the bad stuff away. I thought, oh, crikey, it looked like a shark bite. And I thought, oh, this is going to take ages. And he said, no, a couple of months, he said, and it'll be fine. And it is in July, and you wouldn't think it's the same leg. It's been fantastic.
It seemed like a really simple, good idea. There were only 2 layers, less bulky, patient could get their shoe on. They were a lot more comfortable, we were told. Patients were reporting the fact that they actually quite liked wearing them compared to the 4-layer system.
It's brilliant stuff. It really is. It's not thick, it's not heavy. I had a leg ulcer before and I had the 4-layer bandage on that leg, and it's so thick and hot and debilitating, and it moved as well. Because you've got the 4 layers of bandage, they slide against each other. It's just one of those things, it's going to happen anyway. And twice I had to cut myself out because it was cutting circulation off in the leg. But with this one, never any problem at all. It goes on very easily, it's very quick, and the little football on the side, the way they stretch it, you know, it's magic to watch.
With having the guide on the outside of the bandage, that allows also some continuity of care, so that we're all clinicians, whether you're in hospital, whether you're a district nurse, whether you're a practice nurse, and we're all applying the same consistent therapy.
I was able to get around a lot more quickly, a lot more confidently, because you can feel it, the compression obviously, all up your leg, but it's not that tight, it restricts, and you know that nothing's going to move inside it and unravel.
I think certainly for us as a service and for our patients, K2 has been a huge success, and we're very pleased to continue to use it.
It's like a hug and a bandage, that's the best way I can describe it.